Good afternoon and welcome. It's 3 o'clock precisely, so we'll be starting the second in our two-part webinar series, Creating Communities of Opportunity, the intersection between health and community development. This is a partnership webinar series with the County Health Rankings and Roadmap Program and NeighborWorks America. You'll hear a little bit more about who County Health Rankings and Roadmap Program is if you don't already know them. But first, let's start with logistics. Okay, so some of you have already started to ask questions in a Zoom webinar, and this is just a little bit more about it. If you have a question for our panelists, simply click on the Q&A control. You'll see it right below the screen. And when you do, the Q&A box will open up. You'll type in your question, and then you'll click Send, Submit Your Question. So you can send in your questions at any time. If you want to chat, we'll move on there. You share an idea with all the attendees. You can use the chat to make a comment or to respond to questions that we may ask you during the webinar. To use the chat feature, click on the chat control. The chat box will open up. You see right there, you'll type your comments there. Then you'll print Enter to submit your response. You have the option here to chat with all attendees or just panelists only. So it's my distinct pleasure and privilege to welcome you here. My name is Sarah Norman. I direct Healthy Homes and Communities with the NeighborWorks America. Today I'm joined with my colleague Sarah Sturdivant, who will be answering your questions that you submit in the question box. Hi, Sarah.
Hi, how are you?
And I'm pleased to introduce you to Erica Burrows-Jardy, Community Coach at County Health Rankings and Roadmap Program. Hi, Erica.
Hi, Sarah, and welcome everyone.
And I want to introduce you to Juan Bonilla, Deputy Director of Lawrence CommunityWorks and NeighborWorks Network Organization. Welcome, Juan.
Thank you. Good afternoon, everyone.
We're going to be hearing more from both Sarah, Juan, and Erica momentarily. But first, I wanted Erica to share a little bit about County Health Rankings Roadmap. In a nutshell, what do you do?
Sure. First of all, thank you for inviting County Health Rankings and Roadmaps to be a part of this series. County Health Rankings and Roadmaps is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. We support many communities in bringing people together to look at the many factors that influence health, select strategies that can improve health for all, and close gaps, and make changes that have a lasting impact. And so we do this by providing data, evidence, and guidance for communities. And then we also work together to gather stories and share those stories of communities around the country that are at different points in this journey to serve as examples and inspiration for you and your partners. And all of these activities advance health equity, which we know ultimately leads to improved health outcomes. So that's what we do in a nutshell.
Thank you, Erica. What do you mean by, what's your definition of health equity?
Well, you know, when we're asked this question, Sarah, one of the things that I often do is just kind of paint a picture. So I'm actually going to take the audience through that exercise, if you don't mind. And so I'm going to ask you all to imagine a place where everyone has a fair and just chance to lead the healthiest life possible. Imagine communities with high quality schools, good paying jobs, access to healthy foods and quality health care, and affordable housing in safe neighborhoods. Imagine a place where differences in race, culture, and perspectives are not only tolerated, but are celebrated as fundamental to health and well-being. And imagine that this is how we could all experience our communities, regardless of where we live, the circumstances into which we were born, or how we look. So this is our vision of health equity. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. And why do we believe that? We believe that because every life is of equal value. So achieving health equity actually requires two actions. First, we must eliminate the disparity in health outcomes that we see among different populations. And two, we must eliminate unjust and avoidable differences in health caused by unfair policies or cultural practices that create health inequities. And when we create these fair and just opportunities for people to be healthy, we are achieving health equity. And health outcomes get better when health equity is in place. So creating affordable housing is one way to create health equity. And I know that was a lot, but it really explains why health equity is fundamental to the partnership that County Health Rankings and Roadmaps has with NeighborWorks. And with that, Sarah, I'm actually going to turn the tables and ask you a question.
Wait a minute.
So, Sarah, why don't we start by, asking, I want to ask you to tell the audience a little bit more about how NeighborWorks and County Health Rankings and Roadmaps started working together.
Absolutely. So a couple of years ago, NeighborWorks and the County Health Rankings and Roadmaps, thanks in part to support from the Robert Wood Johnson Foundation, became a national partner of County Health Rankings. And one of the projects we worked together on was the Healthy Communities Demonstration Project. We had 28 organizations provided with funding, a learning community, and for some, a County Health Ranking and Roadmap coach to support their work to catalyze cross-sector partnerships to promote health equity. Organizations were provided with 3 levels of grants: seed for early efforts, roadmaps for organizations with partnerships in place, and innovation grants for organizations with strategies that were either ready to move into implementation or already implemented. One of the participants in the Healthy Communities Demonstration Project, NeighborWorks member Lawrence CommunityWorks, is going to share their work in Lawrence later on in this webinar. So, this map that you see before you really has all the participants. The seed are in red. You can see that. That's the early stage. The roadmaps for folks who are sort of moving partnerships into action or making them more systematic, and the innovation where the implementation approaches.
Yeah.
So that's that.
I know, I'm curious about some of the results you saw across the 3 different categories.
Yeah, and I think it was stunning to us how many organizations, even though we had some groups who were seed or roadmaps, a lot of the organizations were at a stage where they are able to move into actually evaluating and seeing changes in health outcomes or changes in the social determinants of health. And so I'm going to talk about this in 2 different ways. One is the outcomes for people in place, and then some of the system changes we saw. So let's start, and they were really diverse. Organizations reported program, community, and system level changes. So one example that you see up there, and I know they're on the line, so I'll call them out, is Community Housing Works was able to see changes in physical fitness, was able to see changes in self-reported stress, and they were a seed grant. So there's the potential to move to outcomes pretty quickly. In Oregon, Housing with Services and Reach Community Development Corporation reported improvements in food security, vaccination rates, and primary care connections among 1,400 residents in 11 rental communities. And in Rhode Island, we have some neighborhood level changes. One neighborhood was a part of that. So that's 3 very different sets of outcomes. And one of the things that was really important and helped us to understand was where were folks starting to cluster around outcomes. And the answer was the most common outcome, 6 or 7 of the organizations were able to report improvements or reductions in unnecessary usage of the emergency department, whether it was 911 calls or emergency department or even hospitalizations. Folks were starting to engage around more holistic approaches like self-reported health and well-being, and that was probably the most common sort of indicator approach, which actually doesn't have results yet, but will be coming.
Right. And we know that systems change is one of the ways that we can really improve health for all and achieve health equity. So why don't you share some of the results or share what you saw happening with systems changes?
Sure. And these are just a few highlights. One of the things is that we were able to see that organizations were shifting investment. And so instead of investing in solely downstream, acute care, organizations were generating investment in upstream preventative strategies. So 57% of the participating organizations in this demonstration project were able to generate new investment for health-related investment by the end of the project period, which is about 13 months. And the investment was diverse. Health philanthropy often stepped in to sort of support pilots, to support sort of systems engagement, and then later, maybe sometimes larger investments were more likely to come from sort of fee-for-service arrangements with Medicaid managed care or other larger institutions. And so a couple examples that I'll share is sort of have that flavor. One is a $20 million investment that United Health Group partnered with Chicanos por la Causa in Arizona around rental housing and housing with services. So that's it in a nutshell, if we can squeeze it into a nutshell.
Yeah, you all had some amazing outcomes with that, and so it was so impressive. And one of the ways that you begin to drill down in terms of what you want to do is by looking at data.
That's right. And I think one of the critical things is we saw that data was critical in terms of starting partnerships, whether it was matching the rental portfolio with patients. They were critical in determining which partner was the right partner, and they were critical in sort of quality improvement along the way, and then ultimately some evaluation efforts. So let's go back to you, because you have some really neat data resources that are important for some of this work at a systems level.
Yeah, I'd be happy to. Most of the you all who are participating today are probably familiar with County Health Rankings and our annual rankings that we release each year. And so these rankings are an easy to use snapshot of the health of nearly every county in the nation. In fact, I'm going to ask you if you have looked at your county rankings before. Let us know if you've looked at it and what county you live in and which snapshot have you actually looked at before. But just this past March, Sarah, we released our 9th annual rankings. And here you'll see a screenshot from the 2018 rankings for Orange County, California, where NeighborWorks Orange County is located. And we're going to go visit some of the work that happens in Orange County a little bit later. So I just wanted to give you guys a quick snapshot of what their, a quick picture of what their snapshot looks like.
Thank you. One of the most common questions that applies in this space is, okay, county level data is great, but we're working in a neighborhood. How do we, yes, we can do a survey, we've done surveys, but we'd like to think about what data is already out there to be more efficient and not to ask people the same questions over and over again. So how can you help folks out there?
Yeah, we actually get that question a lot, and it's a valid question. But to create the rankings, we need to use data that's collected consistently by all counties in the state. However, we want you to look at local data. We encourage you to do that. So we provide a compendium of local data resources for each state on each state page online. So we definitely encourage you to explore that sub-county level data, especially when you're in a large county like Orange.
And tell me more about the reasoning for the rankings. How can community organizations use them to shift the conversation, drive strategy?
Yeah, well, the rankings help communities understand what influences how healthy residents are, and also how long they will live. So if it's okay, I want to demonstrate what I mean by showing our rankings model on the next slide.
Sure.
So some of you may have seen the rankings model, but for some of you, this may be new, and that's fine. But I want to take a moment to show how the model helps to explain what drives health in a community, because our model shows the relationship between policies, programs, health factors, and health outcomes. And I'm gonna wait till you get to that next slide before I go any further into it, because our model is on the next slide.
Yeah, and I'm having a little bit of a technology issue right here, so I'm gonna just put you on mute. Maybe you can try to everybody can visualize this.
Okay. Well, some of you have probably seen our model before, but actually, again, like I was saying, it shows that relationship between health policies and programs, health factors, and health outcomes. So now that Sarah has it projected, I want you to look at the bottom of that model, and you'll see it in red, and it shows that effective local, state, and federal policies can improve health in a variety of factors that in turn shape health of communities. Now, those factors I'm talking about, those health factors, are in blue boxes. And we look specifically at 4 buckets of health factors: health behaviors, clinical care, social and economic factors, and the physical environment. And those that you see at the top in the green boxes, those are the health outcomes. And we look at 2 types of health outcomes to show how healthy a county is. And those 2 outcomes are length of life and quality of life. So I want to show you how this translates into a real life example. We know that expanding early childhood education improves academic achievement, and this results in higher graduation rates, and higher levels of education leads to higher levels of income, which make it easier to access healthy foods, clinical care, and quality housing. Now, all of these in turn influence health outcomes. So you can see why NeighborWorks partners are so important to building a culture of health. I mean, like, not only do your partners help create healthy housing, Sarah, but many are involved in asset building, providing opportunities to improve income and employment, like Juan's organization is, creating neighborhoods that provide a network of family and social support where people feel invited and safe. I mean, you guys are totally all over this model, Sarah, and that's one of the reasons why county health rankings and roadmaps are so connected with NeighborWorks.
That's right. Now we want to turn it to a discussion question. So that's where your Zoom training is really so important. And that we're going to ask you to share what you're doing to promote health equity. So what role do you think you play? And this is a enter it into the chat. We're interested in sort of seeing the range of responses, or maybe what you think your primary role is, and then we're going to share back at the end. So we'll stop for a second or two, but you can keep thinking about it and chatting it in, and then Sarah Sturdivant will sort of share some of the responses at the end, what the most significant ones, the most common ones, or the ones you want to do more of. So while I'm giving a little bit of slide time, but we're going to switch over to evidence, one of my favorite topics. Tell us how the evidence that county health rankings and roadmaps provide can help organizations really make change on the ground.
Yeah, that's a great question. Remember, county health rankings and roadmaps provides data, evidence, and guidance. So evidence is definitely one of those things that we feel is important for all communities as they begin to move forward, because like once your partners have reviewed the data and understand your community's challenges and strengths and kind of figured out what they want to work on, they need to know what they can do, and they need to know what strategies to implement, and they need to know what strategies may work. That certainly is one of the most important factors in deciding what it is that you want to do. You want to understand the evidence that shows how effective a strategy can be at changing outcomes. So we have a great resource on our website that I want to tell everyone about, and it's called What Works for Health.
Fantastic. Can you tell me a little bit more about What Works for Health?
Absolutely. What Works for Health provides a menu of ideas that summarizes the available evidence and provides examples of strategies that have been implemented. Now, strategies, I use that term broadly because strategies can mean policy, a program, a system change, or environmental change. So What Works for Health is a living resource. It's updated with current content, and we add new content on almost on a weekly basis. This is something we do all the time. And as of today, we have nearly 400 strategies available, Sarah.
That's amazing. What does each strategy include, and what will people find when they click into one?
So when they click onto the strategies, they'll find 4 really important bodies of evidence. One is an evidence rating. And that evidence rating conveys the likelihood that strategies will work based on the available evidence, because we want you to know what strategies have been shown to work, those that might work, and those that will cause harm. We definitely don't want you implementing anything that will cause harm. So if there's evidence that it's going to cause harm, we're going to let you know. We also provide a short literature summary that highlights who can benefit from the strategy, what the strategy can do, and if there's information about costs, we'll include that too. We also have a disparities rating to help communities use an equity lens when they explore strategies. Remember that in order to achieve health equity, eliminating disparities is key. So we definitely provide that disparities rating to help you. And then lastly, we have implementation resources to help you move from an idea to action. So you can see how this resource might be helpful to you if you are unsure where to start, but you definitely want to make an informed decision.
Yeah, and it's great too if you're preparing a grant application or trying to think through an evaluation and you want an indicator. I mean, you can use it at different stages along the way. I do think that folks might be interested in seeing a concrete example of what this really looks like. And so I'm going to ask you to share, can you share a little bit about the trauma-informed community development one?
Absolutely. So, like I was saying, like you were saying as well, What Works for Health provide examples. So you can kind of get a glimpse of how our strategy is implemented. And so some of you may be familiar with the fact that several communities around the country are exploring how they can create communities that are sensitive and responsive to trauma. And What Works for Health includes an example from Gainesville, Florida. Actually, we have several examples about trauma-informed care, but I'm just sharing this one with you today. But here's an example from Gainesville, Florida, because I live in Florida. And there's a partnership called Peace for Gainesville, and they're working to create a trauma-sensitive community. And here you see an image of one of their local trainings in Gainesville. This training is a community resilience training. And what they're doing is they're training community residents who have experienced trauma that's been caused by generational poverty or racism, family violence, or other events such as, like incarceration or family incarceration that might marginalize the stigmatized populations. So this is just one example of how What Works for Health can help your network partners begin to shape a similar strategy in their community. It gives you all of those implementation information.
Yeah, and this is particularly helpful because one of the things we saw come out of the Healthy Communities Demonstration Project was organizations taking or expanding their trauma-informed informed approach to the work that they were doing in very diverse communities, thinking about trauma, healing, and growth, thinking about how understanding the neurology of it, understanding adverse child experiences really informed and changed how they did work. So there's examples from New Kensington Community Development Corporation, from the Community Development Corporation of Long Island, and Housing Partnership in Florida, just 3 folks who are using this in their work in the Healthy Communities Demonstration Project. And let me just quickly touch on coaching, because that's what your contribution, your huge contribution to this project.
It was. Again, we provide data, evidence, and guidance, and community coaching is one of our guidance strategies. So what your audience is seeing right now is a map of the United States, obviously, but what's highlighted are the states where NeighborWorks organizations that we coached are located. So again, I'm a community coach. I live in Florida, but I coached Lawrence CommunityWorks, which we're going to hear more about later, which is located in Massachusetts. So the coaches worked with a team of NeighborWorks organizations, and again, our coaches are physically located throughout the country. So we met with them virtually over the course of 12 months. And we met with them for about 60 and 90 minutes each month. And the teams were expected to meet outside of coaching. So we would meet with them. And then the times when their coach wasn't meeting with them, the teams kind of implemented some resources that the coaches may have suggested that they work on. And in some cases, there were some site visits that were provided. Some of the coaches went to communities that needed that more hands-on, in-person, capacity building touch.
And I know we plan to hear from Juan with CommunityWorks, which is a network organization you coach, but can you give us an idea about what you mean around customized support?
Right. So here you see at the bottom my colleague, Justin Rivas. He is a community coach as well. And he coached NeighborWorks Orange County in California. And remember, I showed you their snapshot a little bit earlier. And in Orange County, that's where Santa Ana is located. And Santa Ana is a community that has one of the highest pedestrian injury rates in the U.S. So Justin worked with NeighborWorks Orange, which is a primary partner of a partnership called Santa Ana Active Streets, or SAS for short, because you know in public health you have to have acronyms. So SAS works with folks in Santa Ana to educate them about pedestrian safety, bicyclist safety, and how to use how to share the streets and make public uses of space so that way everyone can be safe. Now in this picture you'll see, in these two pictures rather, you'll see images of when Justin guided his team in creating an evaluation plan and being more intentional, so that way SAS could be more intentional about bringing policy and opportunities into their planning. So that's just one example of how we provided that customized support. And Sarah, we know that SAS has been very successful. Coaching was just a small piece of the equation for that. But I really want to give you an opportunity to kind of brag about what SAS has done, since they are one of the NeighborWorks partners.
Sure, and I can't, I'm really honored to represent them for a second. I can't do it as well as they. And I think there's a couple things that stand out. SAS was created as a resident-led effort. It came out of a NeighborWorks Community Leadership Institute. And over the course of this project, one of the things they really tried to do was take it from a resident-led volunteer effort into a fully fledged social enterprise model. And so really thinking about organizational structure, evaluation, and this had real results for folks on the ground. They were able to obtain new funding, I think, from the city to support bicycle and pedestrian safety efforts, and also to start a community health workers model. And I could just keep going, but I think it's back to you, Erica.
Yeah, they're just been a model community, right? So, and a model organization. But what I want to do before we shift to Juan, because I know you all want to hear from your colleague Juan, but I want to tell you how NeighborWorks network partners can reach out for support for county health rankings and roadmaps. So I'm going to encourage you to please visit our website at countyhealthrankings.org, and there you will see ways that you can get support with data, evidence, and of course the guidance that you can get from community coaches in helping you move forward. When you go on our website, you will see a way to connect to us with this little icon that says ready to take action but not sure where to start. Contact us. It is our practice to circle back to you within 48 business hours. Thanks, Sarah, for letting me give you the audience that overview.
No, that was fantastic. So now we're going to do a little bit of report back. I'm going to turn it over to the other Sarah to share what folks are saying.
Yeah, so a couple of comments. What role do you play in building health equity? And we heard from Sharon and NeighborWorks Sacramento that increasing access to healthy foods through an EBT match savings program is something that their organization is doing. We heard from Kathy Siemens that housing repairs for the elderly so they can stay in their homes longer is something that they're working on. Rebecca Alt from COA says they're collecting data on health inequities in the neighborhoods they work in order to inform the services they provide. And lastly, Bonnie Pickens says from a hospital community benefit angle, funding and partnering with local community organizations is something that they're doing with working with the hospitals.
Wow. Okay. Now Erica is going to introduce Juan and Lawrence CommunityWorks.
So I just want to thank the audience for those responses, because that's great, because it's like a wide range of different things that you all are doing with health equity from a funding perspective. I see you using data and stuff. You guys are on the right track when it comes to building or advancing health equity in your local communities. But now let me just say, as a community coach for Lawrence CommunityWorks, I am just absolutely honored to have Juan Bonilla as a guest on this webinar to tell you about the work that they have done in Lawrence CommunityWorks and just the great work, the great way, strategies they're using rather, to advance health equity and equity there in his community. So, welcome, Juan, and I'm going to ask if you would start by introducing Lawrence CommunityWorks to the audience.
Sure. Hello, everyone. Lawrence CommunityWorks is a nonprofit community development corporation based in Lawrence, Massachusetts. We use what's called network theory, or a network approach, to connect stakeholders and residents to each other to work together on improving, the city of Lawrence, Massachusetts. We have 4 core areas: network organizing, which the philosophy and model of the organization as a whole focuses again on building social capital, increasing civic engagement among the residents, connecting the residents to common life and to each other, ultimately to work together towards collective action within the community. We do build stuff. We're real estate developers, primarily for affordable housing and for both rental and home ownership. But we do also some commercial infrastructure and occasionally some green space development. We have a youth component called Movement City. It focuses on ages 10 to 18, providing performing and digital arts, academics and technology, leadership development, all with the hope of building strong youth. And last but not least, we have our asset building department, which focuses primarily on financial empowerment, credit building, asset building, job training, and again, providing that in a holistic way to help families achieve economic mobility and improve their financial resilience.
Right, and as they do this asset building, there's a model that you all are using to help show the progression that clients are making as they're beginning to build these assets, right, Juan? Can you share that?
Correct. And so a framework, if we can go to the next slide, is the financial progress timeline. And what we're doing here, I'm sorry, the slide's a little bit frozen. So what we're trying to do with financial progress is really just help individuals improve their lives step by step. And so often there we go, thank you. And we present the slide simply to show that individuals have unique circumstances. They all have various variables, even though they have commonality in some issues. Their circumstances tend to be unique and different. And so a core to the work that we do is provide financial coaching. The financial coach works directly one-on-one with each individual and strives to understand their goals, their challenges, their circumstances, and tailor their approach to what that individual may need. So this slide was particularly covered in our own group to help everyone understand that when we're talking about financial mobility, there really is a spectrum. You have folks who are in a financial crisis, and so those folks need immediate resources. And then you have folks who are just starting to get out of a situation that's been difficult. You have those who have had some success, And then you have those that are just doing great and continuing to improve. But at the end of the day, they all want to do better. They all want to improve their situation. And so the financial coach, has to spend some time really understanding where the client is today and then where do they want to be tomorrow. So there is no one size fits all. And so this discussion was important in our planning group as a way to ensure that we were implementing appropriate strategies.
Right. And it actually, that customized support is so important. And this is what led to you all actually applying for some project dollars. And Sarah, I know, is going to tell a little bit about the history of that. And then, Juan, you and I'll pick up in a few minutes. Oh, you're on mute, Sarah.
Yeah, I am on mute. And now, before it didn't want to forward, and now it really just wants, it's got a life of its own, this slideshow today. Ooh. So this project represented a collaboration between NeighborWorks America, the Robert Wood Johnson Foundation, and the County Health Rankings and Roadmap Program. So that's why you see them all on the screen. And for 6 organizations, we worked together very intensively. We're a County Health Rankings and Roadmap coach. Worked with a project team of cross-sector partners in a local way to sort of figure out how to move folks along their journey, take the next step. So Juan, can you tell us a little bit about how that worked for you?
Sure. So our group called the Lawrence Physical and Financial Health Group, it's made up of ourselves focusing on financial capability program delivery, the local health center, Greater Lawrence Family Health Center, where, it hosts the target population, the patients of the health center. Northeast Legal Aid, which provided immediate legal assistance, particularly with families dealing with housing eviction, and challenges with keeping their utilities turned on. And the Mayor's Health Task Force, which is a collaborative here in the city of 90+ organizations focused on holistically on all kinds of issues that deal with health.
Yeah, and Juan, I'm going to circle back and just to you, because I want to ask you, how did Lawrence CommunityWorks and your partners begin thinking about the relationship between physical health and financial health?
Absolutely. So through our work, probably over a decade of providing homeownership and financial education programs, the issue of health continued to surface frequently among the population we serve. From families who were dealing with chronic illness or disability, which impacted their cash flow or ability to save, to those that had no insurance or didn't even have a primary care doctor. Other folks lived in poor conditions, unhealthy conditions, lead, dust, infestation, and some of that led to actually Lawrence has one of the highest rates of asthma among children here. And so, and for sure, many of the clients we were serving were dealing with some kind of financially related stress, just anxious, stressed about their financial situation, not knowing what to do and how to get out of what felt to be, hopeless situations. And so for us, it was clear that we needed to look at health as a component. We definitely saw the direct relationship, and we came across the social determinants of health report, and immediately it made a lot of sense to us. So soon thereafter, we received a call from the Greater Lawrence Family Health Center, and they explained to us their issues with patients dealing with financial insecurities. And from there, we began to collaborate and work together. And this is going back all the way to 2012.
Yeah. So yeah, that's fascinating. But that connection between physical health and financial health, you can see that. Let me put it this way: we know that they intersect, but what did you need to do to bring that system together so that they could intersect and you can actually do something about it? So how did that change the way you and your community partners work, in other words?
Right. So initially, once we began working together, it was, sort of very informal collaborations. They were one-off. We participated in helping our population enroll in mass health. We did various workshops and clinics during our tax, the VitaSite, the free tax filing program. The health center folks will come over and screen folks for health insurance and benefits. So there was some collaboration, but that was very sporadic. It was on on and off, and there was a variety of staff turnover that often impacted the work. We had to sort of keep checking in, learning what we were all doing, and then catching up, and then try to start where we left off. And it was there was a little very little accountability, and there was no unified purpose in terms of measuring what we were doing or whether we were having any impact. And so what the health rankings grant helped us to do is to really come together as real partners and to really work with a common purpose to identify the connection between the financial and health issues that the population was dealing with. And so part of what we ended up doing during that planning period, we were the roadmap folks. We conducted assessments of each other, to learn more about what we thought we already knew, but really realized that we had not dug deep enough into our protocols and procedures, our priorities, our challenges. And so that was a great learning exercise. We developed a logic model, which helped us to not only put a common purpose together, but also to understand what we wanted to solve and what we wanted to measure. We coordinated a process for referrals. We identified some survey tools to help us measure the impact of our work. And, at least for LCW from our end, we've also made some changes. We actually dedicated some of our resources to the partnership. And so we had a credit builder loan program that's designed to help families build credit. And we actually dedicated that program to the health center and the partnership.
Yeah, and one of the things as your community coach I saw was that systems integration is not easy. So what was the first step in this process that you took?
Well, for us, it was as we began having conversations about the issues, finance and health are just huge issues. And so it was important for us to really chunk that down and really understand, okay, what do we see as the problem? Where do we want to focus on? What are the priorities? And so that process really, and to understand what each organization, how we function and move forward. But, one of the things that the health center did early on is to formulate a survey to measure for financial insecurity in their population. And so that was a big step forward. We understood in general that, yes, there were many poor folks, folks with limited resources who were patients of the health center, but we really didn't understand the quantity of the issue. Right. And so the health center conducted some screenings and identified that over 65% of those that they surveyed had tested positive for a financial insecurity issue.
And I'm gonna encourage the audience to really take a closer look at this slide later. And in the interest of time, I'm gonna move you along because I know we want to get to some of the outcomes and your successes. But that 65% of the patients coming to the health center being food insecure is actually quite startling. And so I'm really excited that you guys made the effort to figure out how can we work with these patients and help them become more economically stable. So here we see a picture of what this integrated workflow approach looks like.
Right, and so I think we spent a great deal of time once we understood, and had some common purpose and understood what we wanted to accomplish. Then we needed to look at the various components, and so we spent some time walking through what a collaboration implementation plan might look like. And so part of that was really understanding where are we doing recruiting? I mean, it was the population in the health center is about 30,000 patients. And so we narrowed that down to a few areas, and then we talked through who was going to do the referral process to LCW, and then how are we going to then pick those patients up and begin the coaching process. One example that I can highlight is the utility assistance program At the health center, patients would go to the community support services staff, that's what you see there at CSS, and request a letter of support that they would take to their utility company to avoid having the utilities shut off. And so immediately we began focusing on these folks, simply because it was clear that some financial capability interventions could be helpful.
Right, and what better way to find people who would be vulnerable and really need that financial assistance than those who are actually going to get some type of assistance to pay for their utilities. That clearly shows that they're in some danger there. So Juan, quickly, let's revisit the outcomes of this project, because I thought they were so important in terms of connecting financial health and physical health. And this slide actually shows the survey that you use to measure to get those measures. In other words, to gather that data.
Sure. And so it was important for us to answer, are we helping people improve their financial position, and B, are we helping them improve their health? And so on the financial side, part of what we measure is incomes, credit scores, and net worth as key indicators of financial position. We also integrated the Consumer Financial Protection Bureau Financial Wellbeing Survey, because it is a subjective survey of someone's how they view their choices and their security now and in the future when it comes to their financial circumstances. And then last but not least, we identified a tool called the 12-item short form health survey, which is a form that was already tested. We felt it was designed to be easy to use, and so we felt that would be a good starting point to look at measures on the health side.
Yeah, good. Data is so important, folks. So that's why I wanted to make sure we definitely showed you that slide, so you can take a look at those tools later on and see if that's something that you want to use. So anyway, I'm no longer coaching Lawrence CommunityWorks, so I'm excited about the outcomes that have come so far from this project. Why don't you share those with the audience, Juan?
Sure. I mean, very quickly, I think that we're up to 23 patients that are now in our coaching pipeline. Initially, it was very slow getting started, but we're happy to show that this past quarter we had a lot of great success because we increased our marketing and outreach efforts. But I think what I wanted to share, just to tie in some of the indicators here, is that it helps us to understand where people are at and where they're coming from. And so they're struggling with cash flow. Actually, surprising to us that credit scores were okay, not too terrible. But what was evident is that the cash flow was impacting patients' ability to save. And so, these were the two key issues. They wanted to pay down debt as well as be able to figure out how to increase their savings. So those are things that our coach is working with the patients on to help them improve their financial position.
Awesome. I hope everybody can see how exciting this program is. So what's next on the horizon for this project?
Well, I think the great thing is that we have agreed to continue working together as a strong partnership. And so that's been a great culture change for all the partners. We continue to meet monthly. We continue to check in. We have set some goals for this year, again, so to increase the number of patients that we're coaching. So that's the goal of 60. We are all agreed that we need to reach more funding sources. We're all leveraging our current resources, and we can only go so far with what we currently have. Putting together a formal evaluation plan so that we're keep honing in on testing these tools and then using the information we learn from to feed it back into what we implement, and to more strongly integrate into the Mayor's Health Task Force collaboratively here in the city.
Yeah. So before I toss it back to Sarah, as a community coach, I just want to remind the audience that systems integration is one of the strategies that you can use to really advance equity in your community, and Lawrence CommunityWorks have done this successfully. One of the things I know, Juan, you wanted to point out to the audience is that this does take time. It's not something you can do overnight. And it takes planning, and it takes those honest conversations, Juan, that you said that you had with your community partners about the resources they can bring to the table and what they're willing to give to this work. So thank you for letting me be your coach. I was honored to be your coach, and I'm going to toss this back to Sarah.
Thank you. So we are reaching that, you know, it's so funny. We targeted to do this for 50 minutes and then have 10 minutes for questions. I don't think I've ever had a webinar where it's been precisely targeted and precisely come to pass. So we actually have 10 minutes for questions, so you can chat them out while we are, oh, whoa, we've already got one up because I was gonna go back to one. While we're waiting for more questions to come in, somebody had been asking about outcomes, and I thought it might be a good opportunity to share a little bit more about, one, the outcomes sort of the approach to evaluation you used, one, and also any changes or sort of how you would have done it differently. So one thing I'll share for folks is if you're interested in this 12-item short form survey, it was developed for the medical outcomes study, which is a multi-year study of patients with chronic conditions. And it was created by Quality Metrics. And if you're having trouble finding it, Rand Health does have some of it in the public domain, so you can take a look at it. But one, in looking back, you know, are you going to change your evaluation approach going forward as you sort of move it into the next phase? Are there things you would have done differently? I think it'd be interesting for folks to hear you reflect on that.
Well, I don't know if we do anything differently. I think this is a process and a journey. We recognize that from the very beginning. I think the good thing is that we had, as an organization, had already done a lot of work around evaluation and have some indicators that I presented here already down packed, and continue to collect and present, measure our work using some of those key indicators. On the health side is a little bit more of a struggle, in part because there's HIPAA laws. You've got to sort of take into account, how you share information. And so most recently, we updated and modified our shared disclosure statement. We've also discussed the timing of when that should be filled out. And so initially we were having our coach fill that disclosure out, which is kind of late in the process. And now the health center folks have recommended that the health center folks, the staff, begin having those disclosures filled out at the very beginning. So those are small changes where, as we test things out, we put them together. We added into our process and flow, but I would say that we're still trying to understand the SF-12. We're trying to figure out how to measure progress using the SF-12. But we've also discussed other methodologies, like, are there some questions that we can just ask specifically around financial insecurity and health conditions? So it's a discussion that's ongoing, to be honest.
Yeah, it always is. Great. Well, I see another question. Could you discuss how to connect with nonprofit hospitals for the community health needs assessments that they prepare under the Affordable Care Act? Also, has this led to investments by these hospitals, particularly in affordable housing? I think I'll take a stab at it, and then Eric, if you want to jump in, feel free to jump in. So this is an excellent question. Hospitals have to regularly do community health needs assessments. It's on a schedule, so they're going to be doing it every 2 years. This is done, let me back up. This is actually a national requirement, but there's also some state-by-state differences. Yet, because it's a national requirement, all hospitals have to do it that are not-for-profit. It's only for not-for-profit. So that's one thing to keep in mind, but that does mean that all of them are doing it. In general, they have to make it publicly accessible, and they also have to report on their IRS forms some of the results and the financial information. In terms of sort of the engagement process, there's usually a community input process that starts at the beginning of it, and that's the big way to join it. For example, the neighborhood developers from Chelsea, Massachusetts, their executive director, Ann Houston, was on the community advisory board for a community health needs assessment, and that really strengthened the neighborhood developers' relationship with Mass General Hospital. And one of the projects that they did, it's another financial capability project. Look at that, although with a twist. So the project that they developed with Massachusetts General Hospital was really around helping folks who are housing insecure really resolve housing insecurity and also use financial capability and other social services as wraparounds to help children and families to become more housing secure. And that was, a lot of that was engaging around sort of the barriers to housing stability, whether that was looking at temporary rental assistance, et cetera. So that's one sort of project that came out of this engagement process. Certainly, there are some investment approaches that relate to community benefits. The one that's coming to mind actually technically is not really a community benefit. It's a certificate of need process. Boston Medical Center recently invested a large investment in several organizations in Boston. The certificate of need is somewhat similar to community benefits, except for it's done when there's an expansion. So it's a different sort of trigger, and it's done in 34 states, not all 50 states, but at the same time, Boston Medical Center did invest, oh gosh, now I'm at $6 million, and I'm doing this from memory, I should have checked it out, and some of that investment was in affordable housing in Boston, and I can try to dig that up and send that out after the fact. That's one that comes to mind. You did mention the investment that United made with Chicanos por la Causa in affordable housing in Phoenix. United has made significant investments across the country. In the past, they were primarily low-income housing tax credit investments. The partnership with Chicanos was a different model. So that's not necessarily a community benefit example, but those are the ones that come to mind. Erica, is there something you want to jump in on this? I could go on, but I know we got.
Well, I mean, I could also share, if I may. Yeah, I can also share with Northeast Legal Aid. One of the programs that they have is that they represent tenants at housing court. You know, they have a lawyer for a day program. And so that was part of why they were included in our partnership, because housing instability was a key problem and issue that surfaced in our conversations. And so they, you know, the way that has worked is that anybody who was facing some kind of eviction was connected to Northeast Legal Aid, and they would be able to, at the very least, represent them in housing court and try to negotiate a stay or some kind of you know, mediation to help the tenant stay in the home.
And what I would add to that, because connecting with these community benefit programs is always the question, right? Because we often hear about what the outcome has been, but people often want to know, how do I actually make that connection? So first of all, I'm encouraging everyone to reach out to countyhealthrankings.org, and we can talk to you a little bit more in detail as a coach. But very generally, I will tell you that one of the best ways to reach out to a community benefit program is to actually engage in their community assessment process. You may have already missed that opportunity, but every not-for-profit hospital has to post their community assessment results on their website. Read their community health assessment results, find out where there is commonalities and ties, and then actually begin to think about how your work will intersect with what it is that they have identified as priorities for them. And we always tell folks, visit with these hospitals and learn about them first before you ever ask for money. One of the community benefit program directors I talked to out of a hospital in Montana, I'm not going to name the hospital system, but I'll just say it's a large one in Montana, had a very long conversation with her. She said, Erica, we get asked for money on a daily basis, and no one has ever asked me to come to their community to actually visit their community. We'll start by building a relationship, saying, come visit my community. This is why this is important to both of us. Start with that first before you ask for dollars.
And that is excellent advice. I feel like we could talk about that question for quite a while, but there's another question that was around data and sort of the indicators. I think I'll start by mentioning that NeighborWorks Success Measures has developed a set of 65 tools. They're health outcome tools designed to measure the health impact of varied housing and community development strategies. So that's one centralized sort of set of tools that you can go to. It's available free and online. I think, again, thanks to Robert Wood Johnson Foundation and Kresge, So that's a great compendium. In terms of some of the work that Juan is mentioning, the SF12 is available online if you go to the RAND website, and the CFPB one I think is also publicly available.
Yeah, you can just go to the CFPB website.
So it's funny because we were chatting about the survey, and I am always so terrible. We chatted it out, but please fill out our survey. We always want to know how we can do a better job of serving you, or if you have any ideas for things that would be helpful in this space. So it's up there. Sarah Serderman has published it. And with that, it's 4 o'clock. Have a wonderful afternoon. Thank you, Juan and Erica.
Thank you, Sarah.
Welcome. Thank you for this opportunity. Thank you.
Good afternoon, everyone.